Interrupting our second part of Point of View today to bring you this special COVID-19 roundtable. We had one last week at this time, and we again are having one this week. We're also on YouTube Live right now. And when we do go off of the radio portion of this, and at the end we will stay on YouTube Live just for maybe a few moments to answer a few extra questions if you want to chime in there as well. Our guest today is State Representative Dirk Deaton of the 159th District here in Missouri, and also Dr. Joseph Sheppard of the Free Market Physician. He has clinics in Neosho and Joplin, and also from the First Baptist Church, Pastor Todd Decker. So our roundtable today, again, is addressing this COVID-19, and Dr. Sheppard, I want to start with you. We've kind of been chatting here a little bit about it, but tell us about this virus. From what they're learning more about it, I guess, all the time.
Yes, sir.
But, some viruses, when they come out, they're out, and, if something doesn't touch them or come in contact with them in a matter of minutes or a few hours, it's dead, it's gone. But this one's not quite the same way, is it? Can it hang around for a while when it gets on the surface?
Yeah, we don't fully understand that yet. So, we understand at this point that it's spread by respiratory droplets. So anything that's coming out of your mouth, if you cough, if you talk, if you sing, if you do whatever, you have vapors that go into the air. And the guidance all along has been if you stay 6 feet or more from people, you should be safe. And we don't know if that's actually the case. It's a good guideline. The other question is, once it settles on a surface, this table in front of me, if I had COVID, how long will the virus stay on the table? And we really don't know yet. We've heard a lot of reassuring statements from various people saying, for example, that objects shipped from China, by the time they cross the ocean or wherever, the virus is dead on those objects yet. But we don't have a lot of real cold, hard data on that. We kind of make some assumptions based on other viruses in the family, but we really just don't know yet.
Yeah. And what makes this so much more dangerous than the regular flu?
Yeah, that's a good question. Number one, it's more contagious. And number two, even though the death rates are maybe not as high as we first thought, the death rates are higher than they are for the flu. And so its effect on the lungs is such that it's causing essentially lung failure a lot faster than we would normally see with the flu. It seems to hit harder than influenza does. Once the symptoms start, you can go from 0 to 60 awfully fast and need to be intubated quickly. And so it's rather hard hitting. Its effects on the lungs are fast, and it's just more contagious than influenza is.
And then there's also the situation of the type of individual that gets it.
Absolutely.
Because some people are in very much great higher risk danger area.
Right. Overall, now there are exceptions, and they always get a lot of press when they happen, but the young and the healthy usually aren't affected too profoundly by this. Folks that have pre-existing lung conditions, if you got COPD, if you have asthma, those put you at higher risk. If you have heart disease, you're at higher risk. If you have diabetes, you're at higher risk. If you have any sort of kidney failure, you're at higher risk. And then, of course, if you're already in a setup where you're susceptible to other illnesses, if you're on chemotherapy or have cancer, you're going to be at very high risk for it. So those individuals are individuals that should be enjoying their Netflix subscription right now, just kind of hanging out on the house and catching up with everything.
Yeah, I noticed a gentleman the other day in the store that was on oxygen.
Yeah.
But he was walking around doing his shopping in Walmart, and I'm like, I don't know if that would be a good idea. Somebody like that would be pretty much susceptible.
Absolutely.
Yeah.
Absolutely.
Yeah, so anybody like that's on oxygen, they don't want to be getting out around other people.
No.
Now, and so all right, now, Dirk, there's a lot of money getting ready to be moved around. It's coming from Washington. There's a lot of money not being made because people are not working. And that's a continual thing. We're seeing it day by day. Some places just happen to shut their doors, or they're going to close up for a couple of weeks. That's going to have a big, big effect on our economy. It already is. And then when we look at the government, we've got situations where they kind of look already that they might be in a lot of trouble financially in the first place. And then our states are trying to do balanced budgets, which our government has a trouble doing. But are we, they talk about a recession, but with the money coming in, the money the states are going to get and all that, how is this going to help us?
Well, there's a lot there. Let's try to unpack that. That's a great question. And you're right. There's a lot of money that is and about to move around. Of course, the federal government just passed that $2 trillion package, which has a lot of components, right? There's the direct payments, to many Americans in the form of cash payments that will be going out over the next number of weeks. There's business help and loans and subsidies there, and then there's help to the states as well. And so the state of Missouri is going to be getting some of those funds. We'll have to come back, and that's what we're going to go to Jefferson City next week to give appropriation authority to the departments for that new federal money that's going to be coming in from Washington. So that will help state government, because with sales tax and presumably personal income tax being depressed now due to the economic fallout that this is going to bring, that's going to put a real negative impact on state revenues for the next, I would say, at least 2 quarters. If not more than that. It's really, it's unknown what the ultimate impact on that is going to be, but everyone agrees, and there's a consensus, it will be severe. It is just how severe. So I think the federal money is going to help offset that, but it's still going to be painful. I mean, we're going to be in a situation where higher education is not going to be funded probably next year at the level that we had initially thought even just a few weeks ago. And it's not out of the question. We're going to have to wait and see what revenues are ultimately going to look like. We could, have to even dip into things that are traditionally sacred, such as public education. I mean, nothing's off the table at this point. I don't want to go there. Nobody does. But if you're going to talk about shutting down your state, and thankfully we're not there yet, but if we were to do something like that, there's going to be a price to be paid, and nothing's going to be off the table, because it won't be an option.
Now, will some states be hit harder than others on this? I mean, I know some states have a bigger, they have more people being involved because of more people in the state. But, when you look at the 4-state area here like this, we've already got Kansas that is in a shutdown. Could they be in a different position than we could? They don't have as many people in that, but they do, they do have the same. We do work together a lot, being right here on the border.
Certainly. Well, yeah, there's no doubt this is going to affect, different states in different ways. And obviously, the greater impact that COVID-19 ultimately has on the population, that's going to be the greatest impact. And, of course, we hate to see the loss of any human life. So that'll be the greatest metric that's ever seen. But as it relates to the impact on state government, not every state does have a balanced budget amendment, as we do here in Missouri. And so for some of those states, they're going to be able to mask their, ultimate, the symptoms and problems better than we are, because it's as simple as if the money doesn't come in, it doesn't go out. Now, if you can run deficits, as they do in Washington, as they do in some states, then you're able to more or less, if you want to be irresponsible for the short term, and put it off to the long term, you can try to mask that and go on business as usual and try to ride it out. We don't have that option here in Missouri, and so whatever fallout is going to come, we're going to feel it in the short term.
Yeah. Now, Pastor Todd, this is the time when people are kind of getting depressed. Yeah. I mean, it's great. I think it's great for the family with them being home and stuff, but with that, after a while, and you can't get out and move around, and especially if they have orders that says stay at home more, and you don't need to be doing this. I mean, there are places that look a little bit like the ghost town. You don't see as many people on the roads. You don't see as many people buying gas. You don't see all those things like we normally see. Of course, the restaurants are not being patronized unless they're walk up or drive through, to get it and move on. But people are starting to, feel this, and that's going to touch, and the church is going to have to kind of step in, because this is where the spiritual side comes in too. Drugs can't fix everything.
That's right. Surgeon General said we're going to need the church to help get us through this. Yesterday, we're praying through our membership directory. So April 1st, we're praying for the A's, and April 2nd, the B's, and that. So yesterday, I prayed for a couple, and I sent them a text praying for you guys. And I got a reply about an hour later from the wife, and I said, is it okay if I call you? And I did. Her husband's having to work a lot right now, extra. She can't. She's home all day long. She's watching too much news.
Yeah.
She's getting anxious. She's getting depressed. So we talked on the phone and talked about the different things that she could try to do. Is there a room that needs painted in your house? Now's the time. Yeah. Is there a room that needs cleaned? Is there a closet need to be cleaned? Is there a movie you'd like to watch, a book to read? On a pretty day, can you go out? Can you sit out back? I'm reading through the Psalms right now. Could you go and could you read a psalm a day? So I really encouraged her, and I prayed with her on the phone, and I think it helped. But I really encouraged her when she gets up every day just to set a couple of simple goals for that day of things that she would have something to look forward to and watch less news and be less anxious. And we're going to be doing a lot of that. We need to be doing a lot of that.
Doing a lot of mini sermons right now to a lot of extra people.
That's true.
Yeah. Dr. Sheppard, can you address that too on this area of depression? Because you don't want people coming into your office and asking, can you prescribe something for me to take to settle me down?
Oh, I think more pills will make more people happy.
Yeah, they might make them happy for the short run. That's true. But what do you do when you're faced as a physician, when they come in like that and they want to talk to you about that, and you really don't want to go there because you know this is just temporal, before long they'll be back out and moving around as they normally do.
We try to avoid what we call chemical coping. A lot of times when we're feeling down, we want an immediate fix. And if you've got a doctor that's available to you, a lot of times they're one of the first people you call. And that's okay, but I think it's good that we all have a little bit of perspective on it, where we are, what the causes are, and address it appropriately. I'd much sooner someone start exercising, get out. It's a gorgeous spring. Go out to, here in our area, go out to Bicentennial Park, go hike around there. Get out and enjoy nature and feel better that way. You don't have to be indoors to be safe in a rural area like ours.
Yeah. Well, I know the doctors, make a big difference, but then Dirk, has the governor or anybody talked, has there been any discussions, because I know they're working a lot with the medical industry right now, because we've got to address the issue at hand, but for what's to come later, have they talked about how that there could be, they talk about setting up task force and things like that. But what about dealing with the church like that and setting up where the government and the church work hand in hand together to try to work through this as this, goes on?
Sure. Well, and we talked about it earlier. The governor's done conference calls with pastors around the state. I think we've got another one coming up, and so, I wasn't on that call. It'd be great to get some insight from you as to what that was like. And so I appreciate that he's doing things of that nature. I think that we can all appreciate, certainly in this room, that there's the health, the physical health side of this, and that's what we're trying to keep everybody healthy, right, and prevent any more sickness and disease than as we can. We got to mitigate this, but there's also the spiritual side, the spiritual health of people, and we got to remember that. And I appreciate the sensitivity that we've taken here in Missouri and locally, understanding we got to work with our churches and when you talk about essential businesses, although we don't think about the church necessarily as a business, but it is essential in that the way your church and the churches in our community meet the needs of the people, be it their physical food needs, any other kind of help to that, their spiritual needs and things of that nature. I know it's tough on people. It's been tough on me to not be able to come together as a body and meet. And so I think from the governmental perspective, we've got to make sure that we don't put any undue burdens on that. And everybody's got to use common sense. I think we got to trust people to do that and do what's best for themselves, their church, and their community. But we've got to make sure that we don't lose sight of the fact that there is such a thing as spiritual health, and allow people to continue to seek that out.
Yeah. Now, Pastor Todd, I know you've been on some of them conference calls. So tell us what the governor's saying as he's talking to the churches.
Yeah, well, first of all, we really appreciate it. We appreciate our governor. He's a man of faith, and we do appreciate that he's reached out to the faith community. We've received 2 calls in the last 2 weeks. The first call that he made to us, it was really sobering. It really made us stop and think, and he really challenged our churches on this issue. Last week, it was more of an update, and he plans to do another call this Friday. I think there were 415 pastors on the last call. So we just appreciate that he's reaching out to us. We feel like we're getting good information. That way we can make good decisions, and that he's listening to us too and allowing us to give some feedback. So we feel like this is a time that, to listen to our governor and try to support our state. in the ways that we can.
Yeah. Now, the big thing, Dr. Sheppard, we're on a 30-day extension now.
Uh-huh.
It was supposed to have been the 1st of April, and now that's the end of April. They say we're at the peak time coming up on it. Where are we at in that area right there? Are we really at a place where we're going to see the hardest hit part of this coming at us right now?
Yeah, I don't know that we know the answer to that. All these containment measures, what they do is they prolong the amount of time it takes for the virus to penetrate the community. And that's a good thing because we avoid overwhelming the health systems. The other thing that I think we're all hoping is if this behaves like a lot of the wintertime viruses do, that we can maybe wait this thing out. Maybe it doesn't penetrate the community completely before summer comes, and it kind of washes away, it dissipates for a while. And we just don't know if that's going to be the case or not. If it doesn't dissipate with summer weather, as contagious as the virus is, it seems to me that it is going to penetrate the community at some point. All these measures prolong that time so that we have time to address each person as they get sick. But I can't myself see that in the next couple of weeks we're peaking. For example, in our region where we've only got, in this 3-county region anyway, that last I saw we've got 12 diagnosed cases. I can't imagine that we're peaking in the next 2 or 3 weeks.
Yeah. Now, what about when they say they do models? And this model says this, and we project. Because I heard something yesterday, and this was coming from regular news, that by this time next week, 2,200 people will die a day. Now, how were they getting? Where's this? They go up by a model, I know, that they predict, but it's just predictions, isn't it? You don't actually know.
Yeah, you won't know precisely, and public policy will have some considerable impact on that. In the communities where it's endemic, where it's spreading locally, and it's really not spreading locally much here, it's hard to predict. In areas where it is now endemic and it's spreading from person to person in a community, maybe it's a little bit more modelable. But, here we don't know if and when it's really going to take off in the local community.
Yeah. Now, why is this where they don't want people to do the interstate traveling and stuff like that and moving around and move it around?
That's correct. Last thing we want is a bunch of folks from Neosho to go to New York, go see the Statue of Liberty and do all these things and then bring it back here right now. Because at the moment it appears that it's somewhat contained here, but if you bring a bunch of the virus from out of state, then we have trouble. So
now, Dirk, is that something that the state is looking at to saying we don't really want people out traveling around? I know that they are letting some people still travel out of the country if they're going like into South America or something like that. I know some of them went out and came back. But, I know the governor or the president has shut down, going to certain countries and stuff. But and that's what actually a stay-at-home order, when the state issues that, that's pretty much what they're trying to do, basically, is trying to keep people from moving around. Is that correct?
Yeah, absolutely, and it goes back to what the doctor was saying there, trying to keep people in place and stop the spread, so to speak. But I don't think there's certainly haven't been any conversations that I've been privy to as it relates to closing down the borders of the state, if you will. There was some talk of that in the Northeast, and that was quickly shut down as best as I could tell. I think there's real even constitutional questions as to if that's something that can even be done from the federal level, and so that's not something I've heard so much about. But it certainly, I think, is what the governor's tried to do, and I think others have echoed, and it's certainly, I think, wise counsel and helpful, and it would be a way to be a good citizen at this point is, hey, don't go to these places that are hot spots. Don't do unnecessary travel. And the governor has issued guidance, and again, he's not done draconian mandates as we've seen in some other states, which I've appreciated his approach on that. But they've certainly issued guidance and said, hey, look, don't gather in groups, and keep it in very small groups if at all, right? Stay 6 feet or better away from people. Do these sorts of things, and hey, I've been very encouraged by people doing their very best to observe these types of things and do what they can to be a part of combating the spread of this disease. And so I think those efforts have been thus far really successful.
Now, you mentioned the constitutionality of some of the things that could happen out there. But anytime the government wades into something, it's hard to get them out of there. And then all of a sudden we'll see a new committee or another branch. I mean, what happened with 9/11? We ended up with Homeland Security. Is there very likely that there's going to be something that's going to be tried to brought in from this? And I could understand it. I mean, I can understand the deal trying to watch over our country, when it comes to this kind of a thing. But the overreach of the government's what I'm talking about. It's going to be people like you, people that are in those positions to speak for us, that's going to have to keep them from doing those kind of things.
Yeah, you're absolutely right, Mark. And I tell you, I appreciate that so much, because it's one thing that I've been somewhat dismayed about, that I don't think there has been enough talk about. And again, we certainly have to do everything we can and take all the necessary precautions and do what we can to mitigate this. But at the same time, I think we need to appreciate that if and when we ever talk about curtailing people's civil liberties, say, freedom of movement, any of these things, we have to think about what happens when this is over. How do we ensure and make sure that life does go back to normal at some point? Because, when government grows, liberty contracts. And unfortunately, even in a time of crisis, it seems, and I think just history has recorded this, government seemingly likes to keep what power it's accumulated, even if it's no longer needed.
Yeah.
And so I think that is something that we need to be concerned about, need to be thinking about, because, I'm sure there will be those who on the other side of this will say, well, hey, now we've got a new normal. And hey, that was yesterday, and that was before. But now we've got to do X, Y, and Z, and government needs this new power to do and ensure something of this sort doesn't happen in the future. And that's where I think you could get into that overreach. We've seen this in autocratic countries across the world. Despots have used this to leverage this to increase their power and their grip on power in some of these countries. So I think that's something that it's right to be concerned and be mindful of that, and we've got to be very careful. Look, government can't ultimately solve this and cure this virus. If they had, we'd already have done it, right? And so we're just trying to mitigate it. We're just trying to make it better. And again, we should do that, but we got to make sure we're not trying to do too much and going beyond what we should be doing. I think that's something we should be mindful of.
All right. Now, 2 questions, Pastor Todd. The church. How is this good for the church, and how is it bad for the church?
Oh, good questions. Yeah, how can it be good for the church? Well, it seems like to me that in this, I did a little theological reflection last night with our church, because I don't think we do that often enough, and what this means. And I talked in terms of how God in history has caused this kind of thing to happen. That was an act of judgment. And then some people who would say that, well, Satan has unleashed this evil virus. Well, that's not either conclusion that I draw, but I go to Genesis 3 and the fall and the entry of suffering and disease into the world. So what does it do good for the church, Mark? It makes us stop and think. It makes us reflect theologically. Where is God in this? And I also think, if you look at it, that certainly in my way of thinking, God has allowed this to happen, is then what do we have as the church to learn from this? Is God not stripping away the idols that we have created in our lives and even in our churches? The idols of entertainment, of sports, of power, of wealth. Could God be saying to us that that's not where we should be placing our hope and our trust and our faith? So I think that could be the good thing. The bad thing, it's going to challenge churches, just like it's going to challenge, like you said, Dirk, earlier, we don't refer to ourselves as a business, but yet we certainly have budgets in our churches, and we have bylaws and procedures to follow. And so it's going to challenge our budgets. I think each church will see how well it's done in discipling its people in specifically the area of stewardship and generosity. And as long as people are able, we would expect a certain level, even though we're not meeting a certain level of our budget to be met. Now, if people start losing their jobs and have no income, then that's a game changer. And that's already occurring some. We thought that might in the next month or two happen in Neosho. It's happening right now. So we know that that's going to have an impact. And, we'll freeze spending. We'll look at everything that we can to get through this period. But I believe God's people will be faithful.
Yeah. Dr. Sheppard, how important is it to wear a mask? You see people in pictures in these other countries, everybody's got a mask on. You see them in the stores. Not everybody's got a mask on, but people do have masks on. How important is it to be wearing a mask right now?
Yeah, that's a big news story right now
Yeah.
as well. The early studies showed that it wasn't all that effective in halting the spread of the virus. The question that I think, if we had time and money, which we have neither of, could be addressed in the studies is wearing a mask in public settings when you're not in direct contact with an affected individual, effective in halting the spread of the virus. And we don't have data to show that, but I would suspect that it is. Those early studies, a lot of it were defending the use of preserving the mask for the healthcare professionals where the infection was the thickest. There was and continues to be a shortage there. But now, Pastor Decker was talking about how in their church they have volunteers that are making masks. I don't see the fabric mask being inferior to the manufactured ones. I think it would be wise now when we're in public, when we're interacting with the general public, to be wearing a mask. And that's what we're instructing our patients as well.
Yeah. Now, we know kind of how it's spread. I mean, that's basically, it's coming from the mouth, correct? The sneezing, that's the basic way that it's being spread now. But what about, other ways that, maybe that there's a lot of ways they say, to prevent this from getting to you, washing your hands and stuff. What would you say is the big three? What would be the top big three things that you might do all the time? I mean, there's a lot of things, remember, when they rattle off a dozen of them. But if you just done these top three things, what would that be the biggest help? What would they be, do you think?
I'd probably just say keep it out of your mouth and out of your face and off your face. So, the masks are a little bit of an issue in and of themselves because you put on the mask, it feels funny, it makes your nose tickle, it irritates your eyelashes, and so you're constantly adjusting it. So you're walking around Walmart, you touch an item that someone else has touched, you're touching your shopping cart, then you rub your face because your eye's bothering you, the mask is irritating you. Mm-hmm. And so, I do it all the time as well. We constantly touch our faces, so you gotta quit touching your face. And if the mask makes you touch your face more, then it's probably doing more harm than good.
Yeah.
So big three, I don't know. I don't touch your face.
Yeah. What about your hands? I mean, they say wash, wash, wash.
Yeah, wash. If your hands never got around your mouth or eyes, then the virus wouldn't do a bit of harm to your hands. The fact is, we're touching those places all the time. So if you keep your hands washed, you're not going to transmit it to your eyes.
But
and
what
mouth.
about wearing gloves? I mean, you see people with gloves on, but if they wear them gloves for 2 or 3 hours, don't you get it on the gloves? I mean, you'd have to be changing them quite often.
Yeah, it's all the same. It's all the same. I don't see the gloves being a big improvement over just your bare hands. Gloves are good when you're going to come in contact with bodily substances that you could get sick from. But in the general operating with the general public, I don't see it being all that helpful. Maybe if you're dealing with something especially grimy, and then throw your gloves away and then wash your hands.
Yeah. What about the social distancing? That's the big talk right now.
Yeah.
Everybody stay apart.
Yeah, I think that's a good idea. I think we should keep doing that. Keep yourself physically separated and do lots of service one for another.
Yeah.
Yeah.
All right. Well.
And now I really want to scratch my face.
Yeah. Yeah.
One thing I did the other night, I'm breaking the habit. I put Vicks on my fingers.
Uh-huh.
And it literally, when you start to do that, you smell the Vicks, and it's a reminder not to do that.
Yeah.
Just a little thing there that if you have trouble with that might help.
Yeah.
Yeah.
It's a good tip.
Dirk, we got money coming from the government. We got people out of work. Have you got a kind of a breakdown of thinking of how the money's going to be dispersed and stuff? I mean, the government, you've got the state, they're going to be able to help some. And so is it true now in another week or so some people are going to see checks in their put into their account and stuff that's going to be coming from the federal government?
Yeah, absolutely. So I think the Treasury Secretary Mnuchin was saying 3 to 4 weeks. Now, here's the thing that's interesting for Republicans to be in this position is it's a Republican administration, and obviously the Congress is split in the House and the Senate. The Democrats have the majority in the House, Republicans in the Senate. But you've got a lot of Republicans who helped spearhead this package. And folks, myself included now, who have lambasted big government and bureaucracy as ineffective and unable to do anything, now is counting on the efficiency of the federal government to implement this $2 trillion package, including getting these direct payments out. So I hope it works, but I'm skeptical that it's gonna go smoothly. But they say 3 to 4 weeks if you're an individual that meets the income criteria. So that'd be 75,000 as an individual. I think it's 112,500 for head of household, or if you're filing jointly for married couples, which is going to be most people's situation, it's 150,000. You make less than that, you're going to get 2,400 as a married couple, or 1,200 for individuals, and then $500 for each dependent child, and that'll just show up in your bank account if you use direct deposit when filing your taxes. Otherwise, they'll send you a check in the mail.
And then they've expanded all of, like, we don't have to get our taxes in now by April 15th.
Right, extended that deadline to July.
If we owe the state or federal government, either one of them, is it true then that that's been delayed and having to pay them? Is that both or just the federal government?
Yeah, so the state followed what the IRS did, so those deadlines are the same. Both have been extended. I would still encourage, and though I haven't done this myself, I need to finish my taxes. It's probably a good idea to, if you're almost done or could be done, to go ahead and do that, because that way the IRS will have that most current up-to-date information. And if you use direct deposit for a refund, then you'll ensure that you get that direct payment as soon as possible. And so that would potentially be beneficial for people. So yeah, that's certainly in the works. There's assistance for small businesses too. There's some loans that are even forgivable, and there's a couple different segments and different pots of money there. That's a federal program, obviously. I would encourage any small business owners, if they think they might be helped by that, go to the SBA website, and there's a lot of information there. Again, I think this is going to be a cumbersome process. It's probably not going to work near as well as anybody would hope it to, but hopefully it'll help some folks out before it's over with.
And for first time, I mean, we're seeing not-for-profits being brought into this. So not-for-profits, if a church does have a need, they can't pay staff, they've had to lay their staff off or something like that, I understand that there's even help there.
Yeah, absolutely. And it's interesting. I mean, this was a shotgun approach. No one was left behind, it seems, and there's some help for everybody in this package. Some things I'm not sure are ultimately going to be helpful. I think we might have went overboard. I say we. I'm not part of the federal Congress. This was their doing. But yeah, there's $2 trillion. That's a lot. And so there's a little bit for everybody, it seems like.
Now, and the states are going to get some money too now to help you. So like some of your projects that you were talking about that may get put on the delay and stuff like that, will there be federal money to help that, or is that pretty much just going to stay on the state's shoulders?
So most of the things we're restricting as it relates to higher education funding, things of that nature, this money isn't necessarily transferable, and they just give you a big pile of money and, hey, go do with it whatever you want. It's usually tied, and in this case it is, to you got to use it for this purpose. And most of the payments, as you would understand, are related to COVID-19 and fighting that. So a lot of it's going to go to hospitals, to our local health departments. It's going to pass through the state and filter out to the counties, as it should. So it'll help in some respects there, but a lot of it's going to be used just specifically to fight the crisis here and the disease.
Yeah. So in other words, if some of these smaller, I know you have the big hospitals and they have this, but some of the smaller physicians and offices and stuff like that, they would be able to apply for some of this help. Is that correct as well? Where they've been out some money, or quite a bit of money trying to help treat this.
Yeah, there's definitely a part of the federal program in the package just specifically to help healthcare providers, hospitals. I'm not sure about our primary care physicians and the smaller clinics and things. That would be something to have to look at. But yeah, there's definitely some help for our healthcare providers. in there. Let's hope it's enough.
Yeah. Now, Todd, he addressed, the issue of or we talked about the non-for-profits. Yeah. So, as a church, I mean, this is something that churches have not really ever done. Took federal money from the government, and they would probably, a lot of eyebrows be raised in a church business meeting over this. But if a church is put into the situation, especially if a church has got a daycare facility and things like that, that's really been hit hard in this, and they're either going to lose it if they can't recoup some money to get it started again. What would you do in a case like that as a pastor?
We've never accepted federal money. That's our history. So our Ethics Religious Liberty Commission is kind of advising us on this. We're viewing this differently. Just as if a business had to lay off employees, churches will probably have to lay off pastors or support staff. And so what the government's doing is looking at that in an equitable way to say, if you have to do that as a church, we want to help that person. So I do think this is different. They're not telling me what I can teach or preach or not teach or preach at this point. So I do think that it's something that churches could look at. Each church needs to make its own decision, obviously, but it's been really put there to help churches that are going to have to lay people off or eliminate their position to keep those people have some income coming in.
Yeah. Dr. Sheppard, what right now seems to be working against this virus? We've heard about the Z-Packs and other things, this malaria medicine that you can take. And there has been reports, if they've taken this, people have got better and got over it. So are they still working on, I know there's different people trying to get things, out there and get them on the market. That's something that would be approved that would fight this.
Mark, would you ask me some non-medical questions? I keep getting all the hard ones here.
I think you should come up with something on your own here, Dr. Sheppard. But.
This has been a real tricky thing because, in the past, all of our therapeutic choices are guided by very powerful studies. The power of the studies indicated by the number of people that are tested and by the statistically proven success of the treatment. And we just don't have that here. And so, we're treating based on rumor and observational studies of 30 instead of studies of 30,000. And so it's hard to know. The one that's been touted, and man, I sometimes wish these things weren't even put out public. Right now has been the chloroquine and the hydroxychloroquine, which are antimalarials. Those in vitro, so in lab studies, are showing some efficacy against the virus, but there aren't any quality studies showing how they work in real life. Now, the people that are on the front lines of this are using that in combination of azithromycin to treat the virus, and observationally that is helpful. Our death rates are lower than they have been reported internationally, but we're also somewhat early into our curves here. We don't know. Not everybody that's been diagnosed with it has been through the full course of the virus for us to really say where we're going to settle out. So it's tricky, but the azithromycin hydroxychloroquine combo seems to be kind of the one that is being used right now, and we're all watching what's happening in New York and California, their success rates to guide us here. One thing that I will say is the public seems to get very, I understandably very interested on what's happening on a treatment front, and then the public tries to respond to it. The pharmacies are getting calls, hey, can I get some antimalarials? They're being flooded with it, even though we don't really have any statistically significant number of cases here. And so it's something that we're all interested in, but we need to be careful that we're not going out and getting it when it needs to be on the shelves for when the cases really come out.
Yeah. And Dirk, now, this deal with we've got with, the unemployment. This is something that I want people to, and maybe you can help us understand. If somebody is unemployed right now, they can file for unemployment. But then through this federal government, they can get an extra check for $600. So some of these people are going to be making more money being unemployed than they were when they were employed.
Yeah, so this is, in my humble opinion, one of the worst features of this federal program because, yes, we're going to disincentivize now people to, when this is over, go back to work because the job search requirements have been waived now as well. And so, yes, the feds have added to whatever the state, so whatever you're going to get, and it's based upon, and it's different state by state, and it's based upon whatever your wage is, right? But whatever that is, the federal government's going to come in and put an extra $600 a week on top of that. And so you are going to have situations where if someone makes, let's say, and these are rough numbers, but less than $50,000 a year or something like that, then they're actually going to make more on unemployment due to the plus up from the federal government than they did in the job market. So then you have the problem. Let's say this is all over and done with and everything's seemingly back to normal. You're going to have those small business owners who hopefully needing employees, and maybe that employee can go back to that same job they were in, but now they're going to be forced to say, hey, either you're going to have to meet my unemployment wage, or I'm just better off to sit here and stay at home. And so that doesn't make any sense to me at all. I think it's really going to hurt our small business owners, and it's going to hurt getting people back into the labor force, which, again, people could disagree, I suppose. In my mind, there's few things better for working adults than a job. A job solves a lot of problems. It gives you, the dignity of work and meaning, feeling you're a part of something, and I think it's good for a healthy society, and obviously doesn't hopefully lead to dependence on government either. And so that's going to be a real problem that we're going to have to face over the next several months.
Todd, I imagine you're already looking ahead, thinking, are we going to have summer camps? Are we going to be able to do vacation Bible schools? There's a lot of we don't knows just yet. But are you still making plans? Are you still holding out for these things to happen?
We are. We've pivoted in the sense that we're no longer thinking about what we need to do to survive as a church. We are looking out to our community. We're looking at Bright Futures, Hope Kitchen, the Help Center, Restoration Life Center. How can we come and partner with the existing ministries in our community to strengthen those? But yes, we are thinking in terms of, we're thinking no on camps. We're thinking that's probably going to be a no. But Bible school in July, we're so hopeful because it would just be great. And yeah, we're kind of thinking August in our programming and what that looks like and coming back together. So I think it's going to be a slow summer.
Yeah. And Dr. Sheppard, as this just slowly moves through, they'll just have to keep moving dates back until they start seeing the peak fall. And once that starts peaking, certain part of the countries could possibly get a little more active before other parts of the countries could.
Yeah, certainly. So region by region, as it appears that it's safe, they start relaxing some of the policy guidelines that have been there. And as people start circulating again, you see if the cases start rising. If they do, you may have to enforce them again, and if not, then you say, okay, we're getting back to normal.
Okay, so you're saying that, things could go down, and then all of a sudden, a month later, people all get out moving around because they're crazy. I got to go to the lake. I got to go here. I got to go do this. The ball games are on again. We're running to the park, and
then the cases pick up
again. And then they pick up, and then here we go back again.
And then you got some hard decisions to make. Yep.
Yeah, so that's what they're trying not to let happen.
Yeah.
Yeah. Well, folks, as we're kind of winding down here on the radio portion of our program, don't forget we are on Facebook Live. We're going to remain there for just a few minutes so that we can go ahead and talk about a couple of areas here that I haven't got into and everything. But we do appreciate you joining us today on this COVID-19 Roundtable. My guests have been State Representative Dirk Deaton from the 159th District here in Missouri, Dr. Joseph Sheppard from the Free Market Physicians Clinic, and Todd Decker, who's the president or the pastor of First Baptist Church here in Neosho. And continuing on Facebook Live here, Dr. Sheppard, I don't know if you're aware of this or not, but since this has happened, alcohol sales have went up 55%.
Uh-huh.
And of hard alcohol, 75% of
Wow.
that.
Where's that at, Mark? Where's that? Nationally?
That's nationally, yes. That's
People using that to make hand sanitizer?
Yeah, hand
Is that,
well, not
Yeah.
really. So, Dr. Sheppard, there's a couple of us need to speak to that, but, we got to be careful in letting that, or that'll just create more trouble.
Yeah, it sure will. It sure will. I imagine part of it, people are worried and people are bored. That's probably a big piece of it, and we've got to be careful. I think this is a time when all of us ought to be saying, what can I do right now to become as healthy as possible? I want myself just in prime condition, so if I come down with it, I have no symptoms or maybe a little bit of sniffles. We need to be doing everything to make ourselves healthy.
But by that drinking, can that reduce their immune system and stuff and put them more vulnerable by doing that?
Oh, potentially. I think you're weakening your body. The other thing too is we see it in the hospital all the time that with intoxication you can have aspirations. You end up swallowing your own or choking on your own regurgitation or spit, and you get pneumonia from that.
And it's easy to forget to don't touch your face.
Yeah.
Don't get up to somebody, because when you're doing that, you're not thinking clear anyway.
Yeah, and I think we all have the great uncle or whoever that's lived to 90 drinking, a pint of whiskey a day, and we wonder if that might not work for us, but it won't.
Well, I think, Mark, it has to do with how we're going to cope.
Yeah.
How are we going to cope? What is God trying to say to us in this? Will we come to him, with our anxiety, with our worries? We worry about our families. We worry about our kids, our grandkids, our futures. And what are we going to do with that? And I think the Lord is inviting us to come to him to find the strength day by day, the wisdom that we need, and just to take a day at a time. That's all he's really promised us anyway.
Yeah, and I imagine now the church is going to be challenged, not just for the next month or two, but this is going to be something now that you're going to have to look into the future and say, when, if, or this is going to happen again, how are we going to be prepared the next time?
Yeah, the church is going to look different. Yeah. And I'm going to start teaching in the book of Acts, kind of getting back to some simple ways there about how they did church early. And I think there'll be a lot for us to learn from that.
Yeah. And Dr. Sheppard, how's it going to affect medicine? What's going to happen now? There's going to be a lot more in-depth studies. They're going to put some special groups together.
Yeah, it's going to affect it on a lot of levels. As far as dealing with viruses, viruses are tough. They mutate. Even somewhat understood viruses can mutate and affect you in ways that you don't know. And so there's going to need to be a lot of research on that. Maybe one of the bigger ways that it's going to affect the public is this notion of telemedicine. Telemedicine's been around for years, this notion of video calls or phone calls to see your doctors. And with the contagious risks of this infection, I was talking to another hospital-employed physician. He said, really the genie's out of the bottle. The physicians are now using this to work with their patients, and the patients are using it to work with the physicians. And we're going to find that there are a lot of cases where this is faster, it's more convenient, it's more cost-effective to treat things by telemedicine than it is by an in-person encounter. And so, as physicians, we need to make sure that we're not falling into the trap of doing what is easy instead of what is best. But I think we're going to decide that in a lot of cases, telemedicine is best. And I think there are going to be fewer of these person-to-person encounters moving forward.
Can you address why did they shut down all the I know you're not a dentist, but why did they stop all the dentist work real quick? Because of them being next to the mouth so much?
I think so. And actually, I wasn't aware of that till this morning. Someone mentioned that to me, and I think so. The problem with coronavirus, among other things, is that you can be 100% asymptomatic and still have it. And so you can't trust the fact that if your patient is feeling well, that you're okay being that up close and personal with them. The risk is just too high. So when there are cases in the area, I think you kind of have to close down a lot of that dental work, because until the diagnostic testing becomes faster and more widely available, there's no way to know if you're exposing your staff and to something up that close and personal.
Yeah. And Dirk, the government and this new challenge that's before it, I'm sure there's going to be some bills that's going to be introduced over the next few months that's going to address issues like this and how the state's going to be prepared for something like this. Just as the doctor said, these germs, these flus, these viruses mutate, and then they become something else. So this isn't the last time we're going to see something like this come at us, and we're going to want to be prepared now that we know a little bit more about it. None of us in this room in our lifetime have ever had to see anything like this. So how do you see the government now reacting and what's going on?
Yeah, well, I appreciate the question. You're right. None of us have ever seen this. And I was on the phone earlier this week with a colleague of mine, and who is a doctor. He's a surgeon also from the Kansas City area. John Patterson, who's a representative and serves with me in the House. And I asked him what I thought was a simple question. You know, he's a doctor. You guys know everything about medicine, right? Every doctor knows all the medical questions. And so I asked him something about the COVID-19 I thought was fairly simple. And he said, you know, I don't know. This is my first pandemic. And I thought, well, I guess that's true for every doctor and for all of us, right? And so we are in uncharted territory. You're right. We are probably going to come back over the summer and have a special legislative session. The Missouri General Assembly usually is in session from January to May for our legislative session. We'll have a veto session in September. So we pass the laws, insofar as we do pass them, from January to May, which this just really didn't aid in that. The timing was not good as it relates to passing legislation. And so we probably, other than getting the budget done this year, for next year, that likely is all we're going to be able to accomplish, if that, in this legislative session. So we're going to have to come back when things calm down, and whatever is at the front of everyone's mind, and I'm sure more issues will crop up between now and then. If there's anything we can do from state government's perspective to help on this, I'm sure we'll stand ready and able to do. But again, there's just so many unknowns at this point. We mentioned earlier, is this something that's going to die off over the course of the summer, and then next fall some are predicting it's going to come back, and we're going to have a resurgence of it, and there's just maybe that happens, maybe it doesn't. I don't know. There's just so many unknowns. We're just going to have to wait and see what we're needed for.
Well, gentlemen, have we missed anything today before we shut down this roundtable for today?
Mark, let me read Psalm 3:5.
Okay.
I lay down and slept. I woke again, for the Lord sustained me. And I think we can pillow at night knowing that God is still in control. He's got this thing, and we can trust him, sleep at night. And then I like your poster over here on the wall, Psalm 5:3. The next morning we can wake up and say, good morning, Lord. Direct our path today. We look to you, and just try to live life that way.
Yeah. Well, that's a good way to end the program today. Thank you all very much for being with us here on today's COVID-19 Roundtable. Okay. We good? We clear?